Hi, this is Dr. Germanovich from Restore Orthopedics. Today we'll talk a little bit about why your back hurts and what are some of the most common causes of low back pain. So here I have a model that I'd like to use in explaining why people suffer from low back pain. And when talking about low back pain, I'd like to subdivide it into two categories. One category is someone young, typically under the age of 40. We call that functional low back pain without any trauma. The other category of pain, why people suffer with chronic low back pain after the age of 40, tends to be more often than not degenerative in nature. So what does that mean? Why does your spine degenerate and why does it ache after the age of 40 going forward? So I'd like to give you a brief course in anatomy and talk about degenerative low back pain, and we'll talk briefly about functional low back pain later and some of the causes of that as well. But I'd like to talk about the anatomy as to how your spine is made. So your spine is made of these individual bones that you see here in this model. We call these bones vertebrae. And so the vertebrae have this type of appearance where this part of the bone looks like a barrel, and then you have this bridge-like structure with funny shapes to allow for muscle attachment. So when the muscles pull, it allows for rotation of the spine, extension of the spine, etc. These structures called vertebrae are separated from one another by another structure called a disc. And so the disc on the outside resembles a tire in your car, and it has a strong fibrous structure which contains a different material on the inside of the disc. This material is called nucleus. The nucleus is made of a soft substance that resembles something between toothpaste and crab meat, and it typically is what allows the disc to deform under pressure. So this acts as a shock absorber. When you run or you load your spine, the outer portion, the tire of the disc, deforms under pressure, and then it returns to normal. Over time, the nucleus or the inner portion of the disc on the inside, which has high water content, will degenerate, and the tire portion, the one that's between the two vertebrae, will begin to crack and buckle under the weight and pressure of the upper body weight. And that typically happens most commonly at the bottom of the spine, where most of the weight is experienced. And so we name these structures based on where they are located in the lower back, and we name this vertebra number 1, L1, lumbar vertebra 1. This is the L2, lumbar vertebra 2, 3, 4, and 5. This structure, a base upon which this whole spine sits, is called the sacrum, and the upper portion of that we call S1 because it's 5 fused vertebrae, and the upper portion of the sacrum is called S1. So when we talk about this disc, for example, the one that's most commonly degenerated and causes a lot of mischief, we name that disc by where it's located, which is L5 vertebra dash S1, which is the upper part of the sacrum. So that disc is called L5 S1 disc. And so what happens over time, especially with prolonged sitting, driving, or injuries, is that the outer portion of the disc begins to buckle due to the fact that the inner portion of the disc nucleus has dried out and the disc shrinks vertically. When it shrinks vertically, it also begins to buckle and crack, and it can rupture, and the contents on the inside of this can herniate and cause impingement or pinching of these individual nerve roots that are actually very long and go all the way down to the toes or some part of the foot. And so when this happens, we call this symptom radiculopathy when there's finding like numbness or weakness in the leg. And when there is no numbness or weakness in the leg, but back pain is the only symptom, then typically the cause of that is the following. So we said earlier that when the disc degenerates, the distance between these two bones decreases. And so what it means in the back is that one has perfectly aligned small joints of the low back when the disc height is perfect and optimal. However, when the disc degenerates, the distance between these two bones decreases, the vertebrae shrink, And what happens is that the joint misaligns. It misaligns like this because the spacer is now thinner. And the problem with that is there's a capsule that wraps these joints together. Like there's a capsule that wraps my finger joint to hold all these three bones together. That's why I'm able to move it. In degenerative spine disease, when the discs degenerate, become thinner, the capsules stretch and cause an input of chronic pain signal, which travels through small little nerve endings called medial branches. Medial branches are small little nerves. They provide sensation of pain from the joint to this big yellow nerve. The spinal cord responds to this information same way it would respond to the information if you just injured your back, which is to tell the muscles surrounding the area to go into a spasm and put the whole spine on lockdown so it doesn't move. However, the mechanism is broken because this is not an acute injury, this is a chronic problem. So people with chronic low back pain complain of symptoms such as chronic spasms, locking, stiffness, and just deep aching inside the spine. This typically is the most common generator of pain in the low back, and there are procedures and things we can do to turn that off temporarily, but the pain does come back after a few years. So one of the causes of chronic low back pain is arthritis of these joints that we call facet or facet joints, and the reason for them hurting is there's a distension of the capsule that wraps them, and the ultimate reason why there's a distension of this capsule is degeneration of the discs. So we spoke briefly about what causes low back pain in a degenerative state, somebody that's older than 40 years of age. Now, what else could be causing low back pain? Another reason why someone would have low back pain is due to a misalignment of a structure called sacroiliac joint. This bone here is called the ilium or innominate, and this flat bone that we talked about earlier is called the sacrum. The sacrum and ilium make a joint together, and this joint is very irregular. If we were to look at the appearance of this joint in a profile view, it has lots of little bumps and grooves that don't align properly if there's any movement of ilium forward or backwards, or sometimes it will slip up or down. So common reason for sacroiliac pain is actually misalignment of the pelvis. And that typically happens because of a spasm of a muscle that's not in the back of the spine, but rather in the front of the spine behind all the intestines. And the name of that muscle is psoas, spelled P-S-O-A-S, as we said earlier. And if we look at this image on a computer, we can zoom in on this image, we'll see that this muscle attaches to every lumbar vertebra, every single disc, and it goes all the way down and attaches to the inside of the leg bone. In a profile view, this muscle goes all the way down to the pelvis. It crosses the pelvic rim and then it attaches to the inside of the leg bone. What is the issue with the psoas being tight? Well, the issue is that since it attaches to the leg bone and someone is sitting, the psoas muscle is shortened in a sitting position. And so when someone spends a lot of time sitting down, the psoas muscle shortens. And when someone stands from sitting position, the leg bone now goes down like this, and there's a pool on both sides where the psoas attaches, causing compression of the lumbar spine and causing compression of the sacroiliac joints, which are immediately behind it, and that leads to misalignment and pain. So we talked today briefly about why someone has low back pain, and hopefully that answers some of your questions, and we'll talk later about some of the options we have with regard to functional low back pain, including stretches and how we can get out of these bad binds or spells of spasms in the back and lead a better life. So to talk about how psoas muscle causes compression of the spine, we talked earlier about how it attaches to 4 lumbar vertebrae, L1 through L4, and then it goes down and attaches to the inside of the leg bones. I'm going to demonstrate to you how it compresses the spine. Imagine this is your psoas muscle, this stretchy glove, attaches to the spine here and the inside of the leg. And so when I sit for a while, it causes the muscle to assume a shorter length. And so when I stand up, it doesn't, I'll show you that in profile. When I stand up, it doesn't want to lengthen right away. What it does is that it causes compression of my back, and people who have severe tightness of the psoas muscle tend to walk a little bit with a flexed position in the hips, and you can see them getting out of a car and they kind of hold down to their back and they kind of slowly walk around. Part of that is the tightness of the psoas muscle. So I'd like to show you an excellent exercise to stretch out your psoas muscle and reduce your low back pain because of psoas tightness and sacroiliac joint misalignment. So Katie's going to demonstrate an exercise to stretch the left psoas muscle, and you can do that on your bed, you can do that on a coffee table, or if you have a table like that laying around, you can do that at home. So the left thigh goes onto the table, and to stretch the left psoas muscle, which is a major flexor of the hip, we're going to bend the right knee, and the more flexion of the knee one attains, the bigger the extension of the opposite hip that happens. Notice her elbows are fully extended, her chin is slightly up, and her body weight is all on the left sacroiliac area and on the left hip, causing stretching of the left psoas muscle. As she's doing this, I recommend this to be done for 5 minutes on each side at a time. She's taking deep breaths in and exhaling slowly. And with each exhalation, she will notice like she settles more and more and more, and she can bend the right knee forward a little bit. And this is one of my favorite exercises that I teach to patients who are older, have some disability, and cannot, for whatever reason, do many of the exercises described on the internet.